Somalia remains one of the complex emergency situation. From 1992 to date, there is no clear functionalist government structures that will have provided services to their communities. Current data indicates that over 6.7 million, which is almost half of 17.1 million population of the country, are facing acute food insecurity, with 300,000 expected to experience famine during these seasons, and more than 500,000 Somali children suffer severe malnutrition. More than 1 million Somalis have been internally displaced due to lack of food and water and seek to relocate to areas where they can access international humanitarian supplies or services. Muslim Aid is a faith-based international organization with a vision to alleviate poverty, education for all, and provision of basic amenities for those in need, in order to create a world where charity and compensation produces justice, self-reliance, and human development. Muslim Aid, as an organization, has been in existence in Somalia from the year 1992, when Somalia government collapsed, with a focus in providing healthcare, tuberculosis program, nutrition, WASH, education, and emergencies, as well as religious dues. And in 2022, over 10,000 beneficiaries reached under the projects Feed the Fast and the Qurbani.
In the different sectors we are implementing, and that our focus is mostly vulnerable groups, and during our selection criteria, we incorporate most vulnerable people in the community, such as people living with disability, female-headed households, elderly, minority groups, and orphans, etc. I will give a brief discussion on the different programs. I will jump into the state of the healthcare in the country, and the situation of the healthcare has been gradually improving, even though it has not reached the global recommended levels with low universal health coverage index. It's characterized by the low skilled staff at primary health units and the MCH facilities, inadequate medical supplies, and critically underfunded, relying on well-wishers, humanitarian agencies, and other foreign donors. The drought impacts are cross-cutting and interlinked across the health and emergency. An inadequate response to the emergency needs, such as WASH conditions, e.g. the water shortage, significantly impacts the health caseloads in the hospital, especially with the outbreak of waterborne diseases. And for example, there is a significant risk of spread of disease outbreak with recent AWD cholera outbreak in most parts of the country. Now currently we have a high cases in Doble and Hudur that has led to death of many children. In rural areas where health facilities are scarce and far apart, communities are forced to walk a long distances to urban centers.
So the current health program with Muslim Aid in Somalia is focusing on three major areas: the area of MCH, the maternal and child health, TB, that also includes the multi-resistant TB, and also nutrition. Our programs are spread across the country. We are working in different regions within Somalia. For activities around maternal child health, we're working in Banadир, Lower Shabelle, and Bakol areas. Nutrition program, TB, is also spread across the country. That includes Lower Juba around the Kismayo area. It includes Lower Shabelle. The TB program is also gone across to Middle Juba region of Somalia. So Muslim Aid is doing this in collaboration with a lot of other agencies that are working on the ground. Apart from the Ministry of Health, we are also collaborating and working closely with other government ministries and also other agencies on the ground that are also in one way or another implementing different aspects within the health, nutrition aspect.
In terms of their response in 2022, Muslim Aid under their health program were able to reach over 210,000 beneficiaries with primary healthcare service provision, nutrition, as well as TB program.
magaygu waxa la yiraahdaa Usmaan Mahando Abshir waxaan ahay Burdo focal point ayaan ahay dadka ku nool deegaanka ama areadan waxay dhan yihiin 10 ilaa 12 bishii bulshadan oo bukaanka noo imaada ama bukaan socodka waxa waaye waa 600 ilaa iyo 1,200 ayaa noo imaadaan xiriir aad u weyn ayaa naga dhaxeeya waxa waaye UNICEF-ka wasaaradda iyo Muslim Aid oo aad nagu taageera maxaan ku raahdaa qaybta daawooyinka nutritionka iyo delivery wax badan ayaan u baahannahay gaar ahaan qaybtan wash program aad ayaan u baahannahay waxaan u baahannahay facility badan ayaan u baahannahay sida maxaan ku yiraahdaa qaybta deliveryga waxaan u baahannahay equipment ayaan u baahannahay qalabka qaybta dhalmada waan u baahannahay iyo facility-ga kale oo maxaan ku yiraahdaa lagu shaqeeyona waan rabnaa waxaan rabnaa kale ugu weyn aan rabno waa seminaaro tababaro inaan helno tan ugu weyn aan rabno tababaro in maxaan ku yiraahdaa groupka inay helaan tababaro inay helaan
magacayga waa Xaliimo Usmaan Maxamed waxaan ahay qof ku xiran MCH-kan xaafadahana deganahay Kaabagudeyn gaar ahaan Dhirkeende hadda alxamdulillah ilmaheena intaa ku talaalanaa haddii maxaa lahaa oo la dhaho markaa uur aa leenaa camal markaa dhaleena intaa imaanaa maasha Allah mararka qaarna waxaa jira Muslim Aid hay-ad loo dhaho waxayna siiyaan malmalaatada ilmaha liita iyo maxaa la uureeda maxaa lahaa maasha Allah MCH-kan waa u riyaaqnay MCH maxaa lahaa oo fiican waay maasha Allah aada u soo dhaweynayna insha Allah
magacayga waa Raabic Xaaji Caddo degmada deganahayna waa Wadajir Burdo MCH waxaa ka helnaa adeega caafimaad malmalaato hadduu cunug hadduu xanuunsan yahay waa la daaweeyaa sidoo kale waxaa la siiyaa adeega caafimaad dhiirigelin waa la siiyaa
My name is Dr. Yasin Salah Shabdot. I am one of doctor of MDR Center. We was working hard working in MDR TB Center for patients to do a checkup and also to do for TB start in MDR. The patient comes from a lot of TB centers in Mogadishu and also South Central Somalia. We'll start the treatment as soon as possible, and every month this patient will get the check-up monthly for follow-up. Every patient, the World Vision give incentives for monthly $50 for beneficiary, and also Muslim Aid will get the intensives of MDR staffs and also running cost of TB center. We'll appreciate all of stakeholders such as Muslim Aid and World Vision.
بقول اسمه نذيرة اسمه محمد باي أنت كتب بقول خلاص مقاس كراضة هي بابورة اللي كان أنت صار بسوي ذا هذا كسر واكريسة برجع صار اللي وذا ده صار دقارة إلهي الله إن ماشي مريت قطع راسه مريت كان حسن وليد ذلك بس اللي سينا وليد ذلك داوية اللي سينا وليد ذلك وملي قدينه
حاو نور محمد قولك إمادي براو هذا ورونا الحمد لله هتسدي أوقات بشانا لح بلودا إيدا ما بشانا إيدا لا يسوي تدوي.
The other aspect is education, and in education we have a community-based model, and it's a participatory community model that provides opportunities for communities in designing and implementing education programs with the aim of increasing out-of-school children enrollment into the public schools. We have implemented the first phase in 2021, and the second phase is currently ongoing, 2022. And our major goal for this project is to increase access to equitable primary education for 500 out-of-school children through the community-based model. This one is for the previous year. So we have key barriers of the children and which prevent them from getting a proper education in Somalia. And one of the key barriers are a long distance to the schools for some families living in the villages, which is quite a challenge. There's also parents not able to afford school fees for their children, and also poor learning environment in the schools in terms of infrastructure, and of course with adequate training of teachers, which makes it a poor learning environment, and displacement of communities due to the drought, the ongoing drought, and the families moving from one area to another, and this makes the children not able to continue their education. And there's also the biggest barrier of course, in the girl child education is parents not valuing the importance of education for their girl child, making it the number of children in the schools, a high percentage are male compared to the female.
Under the education program, Muslim Aid established historically institutions such as Kismayo Primary Secondary Education Facilities, that is in Kismayo, and Bosaso University. In 2022, Muslim Aid under the community-based education programming benefited rather 500 beneficiaries out of school children, as well as indirectly reaching around 6,000 in all the 5 facilities.
And the other project is emergency.
In the emergency response for 2022, 2,005 households were provided with food aid and non-food items.
One of the things which is affecting in the emergency situation in the country, the first one is drought. And Somalia is facing unprecedented drought, the like of which has not been experienced in the past 5 decades. So far, 5 rainy seasons have failed, with 6 rainy seasons projected to be below average, totaling on to 2.5 years. The cumulative impacts of the consecutive seasons of poor rainfall and the persistent drought are expected to lead to worsening of the humanitarian situation in the country. Moreover, 8.3 million people across Somalia are expected to face crisis, which is IPC phase 3, with Bai region and Mogadishu projected to farming IPC 5 in the event humanitarian efforts are not scaled and sustained. And Somalia is experiencing armed conflict between the government and the extremist insurgents. And recently, the government campaign to eradicate the groups has led to more clashes. The volatility of the situation will likely impede humanitarian assistance deliveries and services, especially for our key programs such as nutrition and health assistance that rely on the delivery of in-kind or in-person services rather than cash-based transfers. The other issues coming up from the clashes and the drought is displacement, which is affecting the country. Somalia is one of the countries with the highest IDP population, with an estimated 3.8 million. The primary driver of the displacement are the drought, as mentioned, and the conflict, coupled with other stress such as the rising prices. The IDPs across Somalia are poor and have limited livelihood assets, few income earning opportunities in the context of abnormally high food prices, low access to communal support, and high reliance on external humanitarian assistance.
With the current pressure, the need is so enormous, and we will request well-wishers, donors to focus this time around in Somalia. We will continue as an organization to find a leverage that is likely to create opportunities for resources or fundings so that we are able to help the needy, and the need to have response for those particular needs is essential.